Hi, everyone. Today we want to take a look at backing up just a little bit to look at what you've learned about social welfare policy so far and how does that really fit with what Postman is talking about in his book entitled How to Watch TV News. This week, the PowerPoints look at this relationship between the news and also the other historical, political, social, and cultural factors that affect our interpretation of what kind of policies we should have and what kind of policies we shouldn't have. We talked 2 weeks ago about the convoluted definition of social welfare policy. When I see you next week in class on the 12th, please come prepared with your ideas to discuss what is meant by social welfare policy. I'm going to throw out some ideas today about why defining it creates such a problem for us and why in the course of our class discussion next week, we are likely to see so many different definitions. This week, in terms of its relationship to the Postman readings, we want to look at, is it a definition that we can use that will work for every social policy we have in this country or every social policy that we want to have in this country? In the context of the Postman readings, what is it about the definition by Compton et al. That makes it insufficient for us to use it for our definition? And I'm going to give you a hint here that there's likely more than one reason. This accounts for why we expand the definition of social welfare policy to include a variety of different factors. One of the reasons that we move beyond the Compton definition is because it ignores the connection between the private and public sectors. This speaks to the issue of the fact that policies exist in both the private sector and the public sector, and that these policies may overlap and may in fact contradict each other. Different policies and resources exist at the federal, state, city, and community levels, and there may be initiatives and funding at each of these levels for each of these policy initiatives. Some federal policies, for example, may exacerbate the problem of homelessness by inadequately funding affordable housing, and this puts pressure on the local communities and foundations to empower the homeless, and this may result in having to partner with private developers to develop affordable housing at the community level. The definition by Compton et al. Also ignores how social welfare policy is embedded in our tax codes. You may not know that our tax codes specify both the collection and distribution of tax dollars, and as was the talk of the town just a couple of weeks before the new year, the federal government was all about, quote, reforming, end quote, the tax code. Now, the initiatives that they made to give the wealthy a bigger tax break and maybe give you an extra $1.50 a week in your paycheck had nothing to do with tax reform. Clearly, because so many of our tax distribution policies depend on tax collection, it should be clear that wealthier districts collect more taxes, so can afford to spend more on social welfare policies. And this is part of what contributes to the vicious cycle of so many impoverished neighborhoods and communities remaining impoverished. Some portion of federal taxes collected from the states goes back to the states, but it's not proportionate. So, for example, Connecticut had strong objections, as did California, to the new, quote, tax laws, end quote, that were passed before the end of the year in 2017. because they pay a disproportionately large amount of their taxes to the federal government, but don't get all of those back. The definition also misses the connection of social welfare policy and other types of policies. Social welfare policy is intricately linked to court rulings, administrative policies, budget policies, and other types of informal policies. The administrative policies can sometimes constrain the activities of officials and advocates. That is, they can limit the extent to which advocacy can take place for particular vulnerable populations. And informal policies, such as those that shape how we conceptualize a problem, also can miss the connection. So, for example, you may have a CMH organization that one organization decides that child welfare workers are going to see their job exclusively as helping children who've been seriously abused or neglected. Or maybe a CMH will focus their efforts on wanting to construct preventative programs to educate at-risk parents. So if you move from CMH or Department of Health and Human Services, DHHS, between those offices, you may find that different counties and different states approach those policies differently. The other definition by Compton et al. Does not account for non-decisions. That is, ask yourself, does the failure to develop a policy constitute a decision in and of itself? That is it really a decision about how we prioritize our policies? And then lastly, this is probably the most important reason, and maybe the one that is talked about the least, is that, as Postman points out in Chapter 1, the definition by Compton et al. Ignores the important contributions of the historical, social, political, and cultural context of policy development and implementation in this country. Now, there are some downsides to social welfare policy, and it's up to you, especially as an MSW, to use astute judgment and keep a skeptical eye out for how some social welfare policies can actually contribute to oppressing various groups. And part of this has to do with the fact that our priorities may not always be rationally chosen and are often influenced by strong economic, political, and other social forces. And this, I think, is much of what Postman is trying to point out in Chapter 1, especially the impact of the media. So, for example, if we look at the knowledge we have about the impact of secondhand smoking and its effect on children, there's no doubt in the clinical research that secondhand smoke from parents negatively impacts their children in significant ways. However, we don't have any real social policies around secondhand smoke, except for as it really relates to adults. And that, in large part, has been left to the states to determine. So in Michigan, of course, we can no longer smoke in restaurants and bars. However, that doesn't address the problem of secondhand smoking in children, and in large part, it doesn't do that because big tobacco funds political campaigns. And in funding political campaigns, it is a powerful tool for influencing our legislative agenda. So the fact that we know that secondhand smoking is bad for kids doesn't really get addressed because of the influence of big tobacco in our political campaigns. Secondly, social problems are human constructs, and they are not purely objective phenomena. The simple act of defining a phenomenon as a social problem means that we are defining them as requiring human intervention to be solved. It is important that you view these social, quote, problems, end quote, with a healthy skepticism, as I said earlier, because by implementing social policy, you can create new problems. For example, at some point in the 1950s and early 60s, as both big pharma and big medicine began to rise and garner more influence in our campaign structures, childbirth at home became defined as a problem. And though people can choose to have their children at home with the aid of a midwife, it's a discouraged practice, and women are scared into going into a medical setting to have their children. And midwives now are highly, highly regulated and licensed as a way to guard against this policy that hospitals and big pharma disapprove of, or at least are in conflict with. So the social conditions that underlie social welfare policy are extremely complex. And the data supporting the contention that something is a problem should be thoroughly examined. I can't say that strongly enough, especially in lieu of your reading for this week in the Postman book. So ask yourself, in an era of information that is flashed before us on TV or on the internet, is it possible to have the time, energy, and resources to thoroughly examine social policies for their broader effects? And if not, what would be required to make it possible to do that? There are no simple solutions or panaceas for these complex problems. So they don't lend themselves to easy solutions. And you may be finding this in your own work with your own agency policy analysis. Most social welfare policies are deeply embedded in the values and beliefs of those people who are developing the policy and are deeply rooted in the historical, political, social, and cultural context of the time. And this is pointed out again in the Postman text. Solving problems requires persistence, and you should be aware that simple solutions to these social problems often promote class, racial, and gender prejudice. So, for example, the problem of the wealthy white people in Lansing failing to understand the impact of the Flint water crisis, or the politicians in Washington who are primarily white and wealthy failing to understand the structural factors that cause and sustain inner city problems of crime, disease, unemployment, delinquency, and welfare dependency, are a result of the fact that they aren't of those environments. So we may save, for example, we may save money on welfare in this country, but then what other problem do we create? The competing functions, I apologize for that, the competing functions of the effects of social, economic, and policies. I just want you to ask yourself here, do we have enough resources to do everything? If you had to prioritize funding social, economic, and political policies, all of which improve social welfare, which would you put first? Consider here what you learned about the extent of corporate welfare funded by our government, both in the link I provided under the material for the week and in your 2 slides below. Okay, so give consideration to these factors as you read the first part of the Postman book. We'll talk about them a little bit in class this week after the presentations are complete. And you'll see them resurface in the policy analysis assignment that's going to resurface for you or surface for you this week, midweek. Thanks a lot, and I look forward to seeing you next week on the 12th. We're in room 129 in STAR.